I'm going to talk today about, first of all, about trying to think a little bit differently about digital design and innovation practices. So I think it draws on a lot of the conversations we've already had this afternoon around innovation and design. And I also want to start to question the participation of older people and carers in co-design practices. And I'm going to do that through talking about a project that I've been leading at the University of Bristol. So the project is called Tangible Memories Community in Care. And when we started this project, we had an image in our head of a relative leaving a care home after an older person had died with a box of objects and ornaments. And we thought to ourselves, what if that relative didn't know the stories that were attached to those objects and ornaments? What if the relative didn't know why the older person had kept those ornaments and objects over other ornaments that they'd got rid of? And what we wanted to do with our digital design process was to put the story back into the material objects that the older people had kept for some reason. So the project was funded by the Arts and Humanities Research Council in the UK. We were a very interdisciplinary and cross-sectoral team. So from the university, we were social science researchers, computer scientists and historians. And we worked alongside artists and designers, care practitioners in care settings, and a local charity who spend a lot of time in care settings called Alive Activities. Our aim really was to co-design innovative social technologies to support democratic community building. I don't know why it's done that. And therefore quality of life and care, really, in care homes. So we were not interested in that surveillance and measuring and quantifying older people living in care. We were really interested in something very different. We wanted to think about how the stories that we collected could help older people to curate and represent their lives in digital spaces, but also that they would be using their own material lives, those objects and ornaments that they'd collected and kept through their lives, as a resource for this. And we worked in 3 different settings: a dementia care facility, an extra care facility, and a private care home. So what started to come up around this was really thinking about the relationship between the digital, the material, those objects and ornaments, and relations or practices of care that we were observing in those care settings. And we sort of set this into some of the contexts that we've been hearing about today around the growth of personal digital data, for example, the social media, the health apps, the stuff that collects information about our lives. But at the same time, we didn't want to forget that the material object is also a really important container for memories and stories. And there's been a lot of research and literature that has suggested that. So when we started to think about community building and the design of digital technologies, we started from the material, I suppose, and thought about the element of touch involved when we're interacting with material objects. And we were really interested in how touch related to care and compassion as well within those care settings. So rather than thinking about the design of hard technologies like computers and mice and laptops and all the rest of it, we wanted to think about designing tangible technologies. So tangible technologies that you can pick up, interact with and touch, and that feel good and look aesthetically pleasing as you do so. And we thought it was really important that those tangible technologies would build from and make use of the material and associated immaterial memories and stories of the older people involved, and also enabling these stories to be somehow digitally captured, because very often they're not digitally captured. And a lot of the older people we spoke to said that they wanted to leave their stories. They wanted to leave a legacy, was often what people would say, for their grandchildren, for generations coming up. So what we did was try to co-design technologies that were both embedded in the everyday materialities of the care homes we worked in, but also in the material worlds of those we were designing with. Hopefully that makes sense. So how were we thinking about digital design or innovation practices differently? And this is borrowed from science and technology studies too. So we were trying to think of these design practices as socio-political or public interventions that brought different people together to have a conversation about what we should be designing. So I've said sparking publics, so bringing people together in different ways. And that through sparking these new publics, we could raise controversial issues, in this case around community and democratic community building in care settings, but also around care and how we understand care and what care is. And we were doing this in order to open up the discussion around these, what we saw as really controversial issues in the care settings that we were working in. So rather than designing products for a market, and we've heard a lot about designing products for a market and thinking about that innovation practices as involving that, what we were trying to do, based on Cristiano Storni's work, was designing things. So this we characterize as socio-material collectives of the human and the non-human that start to bring things up. They start to bring messy issues or controversies to the surface. And in doing this, we were bringing diverse people together. And when you bring diverse groups of actors and stakeholders together, things can get difficult, things get messy. And when things get messy, this raises questions around who gets to participate in these processes too. So there's a couple of questions I want to explore a little bit more in this presentation today around how can we design things together without isolating or excluding people. And I want to sort of trouble some of the participation that we weren't able to engender in this project, as well as talk about what we were able to do. And also, what designs can we create that allow us to maintain our differences while somehow remaining working together on these problems? So we developed a methodology of co-design that involved 3 iterative processes. So these didn't happen in a linear fashion, but we went backwards and forwards between these different aspects. So one was around building arenas of collaboration and mutual learning. So we did this through building long-term, and that's really key, and new partnerships where differences and controversies could coexist and people felt comfortable to raise dilemmas. We wanted to try and legitimize entities and actors that are often marginalized. So this involved making visible and making tangible, because visible is not always enough. Sometimes you have to touch something to understand it. Some of those socio-material relations, so some of the things that were going on in care settings all the time that you might not necessarily think as being related to what we think care should be, for example. So we wanted to take account of the affective, the political, and the material relations that were going on there. And the last is, sounds a little airy-fairy, and this is very arts and humanities rather than social sciencey in a sense. What we also were trying to do was to co-create spaces of passion, imagination, and engagement. And we did this through using quite traditional design practices in many ways, but making these design practices participatory. So I've called this co-tinkering, using design artifacts, probes, and processes. So I want to say a little bit more about each of those elements and how we did it and how they came about. So first of all, we built a really diverse team, and that was really important. But not only did we build that diverse team, but also we tried to create a space for that team to work where it wasn't the engineer and the designer that held the power, or the sociologist who held the power, or the care worker who held the power, but we were all in it together, and we were all listening to each other, realizing that actually we had different things to bring, but all of those different things were equally valid and important. This was not always easy, and I've characterized this as a site of uncertainty, a negotiation, a constant negotiation between us about trying to understand each other. But I think lots of the stuff we said already today suggests that those kind of emerging publics around design are really important. And it's really important that we're having those difficult conversations between designers and sociologists and care workers and older people themselves. So we did this in lots of ways. We familiarized ourselves with each other's work, our priorities, our values, and the settings in which we were going to be working. We spent a lot of time together in the care homes, observing stuff, coming back, talking about what we'd observed, often talking about really difficult things that we'd observed, actually, that we found personally quite upsetting or emotional. And we talked about those emotions together as well. And I guess what we were trying to do was to respond to what we were seeing, the situated material conditions that we were coming across. But we were also interested in thinking about different futures and intervening in some way to create something that was different to what we were actually seeing. So what about the second one, which is rather grandly called legitimizing entities that are marginalized? What we were trying to do was to see care itself as a controversy, so to raise this as an issue. Is it okay the way that care is happening in the settings where we are? And we did this through trying to make visible and tangible some of the care, what we thought were the care practices that we were observing. And we saw lots of different things that I'll talk about in a little while. I think it was really useful that we had artists involved with us because they were able to pick up on stuff that we hadn't necessarily seen as researchers, things about the materialities of the setting, for example, or the affective issues that were going on. It was really important that we had care practitioners involved who were there every day in the care settings and able to really give us a nuanced understanding of what was going on when we were looking at caring practices. So how did we do this job of making visible and tangible? We did some quite traditional social science research. We did day in the life of ethnographies in the care homes. So we spent a whole day there, basically, where we kind of tag-teamed from early in the morning until late at night, just observing what was going on. And here we were trying to kind of notice the materials, the text, the technologies, the human relations, and how they were forming particular practices of care. And importantly, I think we were attending to the material, the affective, and the embodied aspects of care that are often taken for granted or ignored in those processes of technological design. So what did we observe? We observed the space invader like tick box records and charts, touching and grooming activities such as nail painting and stroking of hands. We observed the blackbird who sings outside the window every day, who is given a name and an identity by one resident. We saw the jigsaw puzzle, which linked to past experiences of play and engagement in learning with family members long dead. The sound of a tea trolley that created a familiar and often comforting rhythm to the day. We also attended to those individualized and personalized technologies that we've heard a lot about today, such as the wrist monitors and the alarms that are collecting data about the person, but also notice that they ensured a degree of confidence for that person for being in their flat on their own in the extra care facility. And also one resident who told us that actually that a staff member can tell when she's going to have her next epileptic fit by subtle changes in her body, stuff that could never be picked up from a wrist monitor or a Fitbit. So I wanted to sort of start to think about how troubling participation. So this all sounds marvelous. What a great methodology. Let's just go and do it. But actually, we came across a lot of issues when we were trying to do this work that I think relate to a number of different things that are going on in the care settings. So I just want to say that I think the invitation that we're giving to older people and to carers to be involved is non-trivial. What are we inviting someone to be part of when we're asking them to get involved in co-design? And I think we need to ask questions of ourselves when we say we're doing co-design around who or what gets separated out and under what conditions. And I want to try and do a little bit of that. So, first of all, how do we bring residents into the collaboration? So, what we found when we were there was that this idea of entanglement. So we know that care is paid for in a certain way, that the biomedical needs of people are taken into account when we think about how much money they get for their care, and that other needs that they might have are not taken into account when the finances around care are established. We know from feminist accounts of care that care workers are often poorly paid. They're often doing shift work. They're often not trained very well, And so there are big questions around the labours of care as well, and how much emotional labour you can expect a care worker to give when they're being paid £16.50 an hour, for example. There was also the aesthetics of the spaces in which we worked. I'm sure many of you have been into care homes and noted the way that just being in that environment makes you feel. And also the often unruly bodies of the older people themselves and things that are going on with those unruly bodies. So due to this, there was a need to really craft a proposal around the participation and inclusion of older people. Why would they want to be involved? Because when we went there, what we found was that a lot of the older people didn't feel like they had the agency to be involved in our project. They would say to us, oh, we don't have any good stories, and we don't really talk to each other because actually, well, we talk about our illnesses sometimes, but I don't really know what's happened in that person's life. We just don't have that space to develop those meaningful connections. They also told us about affective, emotional, and material loss in their lives. So often they said, well, I don't have that object that I remember in my head was really important to me because when I moved here, somebody threw it away. Or, yes, obviously I've lost the relationship that that object was attached to for me and it's too painful to look at it. Or I've moved from my home and that object had a place on the mantelpiece in my home. It doesn't have a place anymore in this care home setting. It doesn't feel emplaced. I don't know how to understand it in this new setting. And older people also told us things like, well, you want to get me making something? I'm not creative. I'm not going there. Fair enough. Or I'm not into technology. I'm not one of these techie people. Go ask Paul down the corridor. He's the techie one. Or sometimes I'm not able to hear what you're saying, dear, or I can't see that screen anyway, or that thing that you're trying to show me. So there's lots of things going on here that made it really difficult. So what did we try and do around this? So we tried to co-create these spaces for passion, imagination, and engagement. And we did this through co-tinkering with those practices of care we'd seen already, like the blackbird or the jigsaw puzzle, and bringing them into our design practices and processes, and also co-creating new spaces of collaboration and encounter. So we tried to do design together. We tried to learn with and from the materials and others together with the older people and the carers. We tried to draw on these existing care practices we'd observed. We tried to make some of these care practices more visible in the design work we were doing. So we had lots of music-led sessions, object-orientated sessions, workshops around money, something that you don't have anymore in care settings, but is really meaningful in terms of your past lives often. We did sensory sessions, smells and fabrics, velvet, silks and furs for residents to touch and smell. We visited museums, we did a story circle, we did creative making workshops, loads of stuff. And we found we needed to do loads of stuff because not everyone wanted to engage with the music making. Not everyone wanted to engage in the creative making. So we had to offer lots of different ways of being involved. I wanted to say a little bit about the proxy objects that we designed. So this is a really good example of the older people themselves saying, I don't want to make anything, you're the artist, you make something, which is kind of fair enough. You're the artist or the designer, you make something. So we had this great session where we had maps out and we were talking about local walks and people were really passionate and they were all talking to each other and having a great time and sharing jokes about these amazing local walks they knew. And the artist had all her materials out and she was saying, well, just, sketch this walk into this tile. And they were like, no, thanks, we're all right. We'll just carry on talking and having a joke and a laugh. So we kind of negotiated with them, well, is it okay if we go away and make something that we think could help you to have these conversations? So that's what we did. And this is the topo tiles that became kind of proxy objects. So these are designed to kind of reflect some of those conversations around favourite walks, but they're ambiguous objects. So they're hills, or they're a local bridge, or they're a castle on top of a hill. And these 3D milled topo tiles could collect stories. And then you can see in the image there's an iPhone, there's an app where you can have more than one story within each tile. And as you move the tile, a different story will play. And you might notice they also tessellate. so they fit together. So you could have lots of these and they can fit together, showing the sort of connections between stories that older people were telling us. So this is partly an example of how you might have an idea that co-design is all about making together and doing it in a certain way. Actually, you have to negotiate and be flexible about how that works in order to create something that might be useful, potentially, as you work with older people. The other group of people that were really tricky to bring into the collaboration were carers. And I've already said a little bit about why that's probably the case. It's to do with the political economies of care, where carers are not trained very well, they're not given status within society and within these settings. There's feminist arguments too related to how people are paid and the emotional labour that they might or might not give to that relationship. Oh, it's gone on one, hasn't it? Sorry. So what did we do about this? So we felt like we had to change the space in some way to enable carers to be involved. So we designed some tangible tea parties where we brought prototypes along, and we had various prototypes that we were showing. We served the carers and the older people. We got them all involved in looking at these prototypes. The carers kept asking us, can I wash up for you? Can I help you serve the cake? And we actually totally said, no, you can't. We're doing it today. We want you to really engage with this stuff. And it did, for an afternoon, create a different kind of space where the carers and the older people were talking to each other in quite a different way. So say sharing, looking at a VR headset and sharing the fact that a carer and a resident had been on a balloon ride, and having a conversation about that balloon ride, for example. But it was really tricky, and it was just an afternoon, right? When we went away, we knew everything would go back to how it normally is. So as we worked with the care settings for quite a long period of time, towards about the last 6 months of the project, we spent a lot of time talking to care managers, talking to older people about how we could embed some of this work more into those particular care settings we were working. And I went in and I was asking, can we have a little space somewhere, you know, a corner where this kind of work might happen? Some very creative care managers in some of the settings we worked in said, well, actually, we've got this whole room. Would you like to design this whole room and change this entire room? So we were like, oh, this is really exciting. But we didn't want to do it ourselves. We said, let's do it together with a team of people from here, residents, carers, and ourselves with some expertise in design and artistic practice to help you to do that. So we designed something called Parlours of Wonder, which we saw as new spaces for collaboration and encounter. And the point of these Parlours of Wonder was that it was very much a DIY process. Anyone can do it. It's not expensive. People can give their objects, people can go to second-hand shops and get objects, and it's supposed to be a process that everybody can potentially get involved in. And I kind of started to think about these Parlours of Wonder as inserting something different, I suppose, into this structure of care or these practices of care that we'd observed. Maybe allowing people to live with the radical potential of this new space, and that this new space might somehow affect some of the other things that were going on in other areas of the care setting. So the space itself, maybe, the thing that we designed as somehow controversial. And that this allowed more agency. It allowed older people, care managers, designers, social scientists, computer scientists, charity workers, teachers, and young people, because we also designed these spaces as being intergenerational spaces. So we had schools coming in and doing sessions alongside older people in these settings as well. And what we tried to do to kind of solidify this a little bit, to make something that was longer lasting and sustainable, was to conduct a kind of what I've called a meta-design project. So we designed frameworks and tools together that could be used by others in different settings. So we have a training toolkit for carers and care staff that they can use to train carers in how to use these kind of methods and engagement strategies and intergenerational work in care homes, and also a blueprint for how you can create your own DIY parlour of wonder. So just to conclude, I've suggested that I think we need to think differently about digital design and innovation practices. That something that was said earlier, that how and when we might use the digital and the non-digital, the material, is an interesting question. That the digital actually now is another layer of everyday life. It shouldn't necessarily be thought of as something special to be designed externally to the everyday life and experiences that are happening within care homes. I think we need to think carefully about the invitation when we're doing co-design, asking questions around who or what gets separated out and in, and how and under what conditions. And I guess I want to suggest that the emerging field that Deborah Lupton talks a lot about, design sociology, is something that we could really work with together. That the role of the designer, social researcher, in building these new spaces for collaboration and encounter across difference could be really powerful. These new temporary publics, or even emergent publics, the coming together of people in collaborative processes, could be really valuable in thinking differently about design and innovation practices. And that's it. I'm finished. Look at that, 3 minutes.